PM. Johnny, could you give us an invocation, please?
Dear Heavenly Father, Creator of all things, look upon us gathered here and ensure that all of our actions are in support of our great Cherokee Nation. Grant us vigilant hearts, give us minds to know you, diligence to seek you, and wisdom to find you. May all today's endeavors begin and end with you. We humbly ask these things in your name. Amen.
Amen. Shelley, roll call, please.
Yes, sir. Mike Dobbins.
Here.
Dora Petzkowski. Here. Keith Austin.
Here.
Danny Callison.
Here.
Julia Coates. Here. Sean Crittenden.
Here.
Joe Deere.
Here.
Rex Jordan. Johnny Kidwell.
Here.
Daryl Leggs.
Here.
Wes Snowfire. Joshua Sam.
Here.
Mike Shambaugh.
Here.
Melvina Shot Pouch. E.O. Smith.
Here.
Condesa Teehee. Victoria Vasquez. We have a quorum.
Thank you, Shelley. Hopefully you've had a chance to look at the minutes. Do I have a motion to approve the minutes? Motion and second. All those in favor? Any opposed? Down to reports for the Claremore Service Unit, Mr. George Vallier. George, are you there?
Yes, sir. Can you hear me?
Very good.
For the month of December, we did 2,216 COVID tests. We vaccinated 1,186 patients. We started the month with a positivity rate of 13.62%. And by the end of December, by the 31st, our 7-day rate was up to 23.57%. Out of those 1,402 tests that were positive, those were, or out of all those tests, 1,402 of those were Cherokee Nation citizens. In December, we gave 134 doses of monoclonal infusion. And just as a reference, in January we did 301. That was after things really started to pick up the pace. We had 18,121 total ambulatory care visits for the month of December. We filled 30,683 prescriptions. We had 3,271 patients come through the ER and delivered 32 babies in December. Does anybody have any questions?
Questions for George? George, could you state, do you have a vaccine mandate for your employees?
Yes, sir.
Can you?
We've got about 83% of them vaccinated. The rest of them have exemptions.
Oh, exemptions, okay.
Yes.
So you add in the exemptions, then you're 100% covered now.
Yes.
Okay. George, and actually it's in the Cherokee Health Committee report, they always state the IHS provider vacancy rate benchmark. Says 25%. Do you know what the vacancy rate is at Claremore?
I think we only have 2 or 3 openings, a couple openings for providers. I thought, let me look here. We were recruiting for a hospitalist, a pediatrician, and a CRNA. So I know of those 3. In fact, I think it's 2 CRNAs, so 4. 4 out of 39 positions.
Okay. Thank you, George. Any other questions for Mr. Vallier? See none. Thank you, George.
Thank you, guys.
Okay. Up next, and Cherokee Nation Health Services Director, Dr. Stephen Jones. Dr. Jones, are you there?
Yes, yes, sir. Can you hear me okay?
We can, yes.
Great. All right. If we'll start off with the report. Most of the things you're kind of used to that report now, so you see a lot of the same information, just in updated information. I'll point out that crossed over the 100,000 mark of vaccines this last month. And then, according, the CMS report, or the Purchase Referred Care report, you'll see is at 96% for this last month. A couple of the other things I want to point out and report to you. Last health committee I wasn't able to attend, and I think Mr. Caldwell covered that for me. And one of the questions that came up was about drug disposal. So I want to update you on that. Patients can bring in medications, unused medications, to the pharmacies, and they will dispose of them. However, since that question was raised, we started looking into how can we make it more efficient, and how can we take out the pharmacy part of it, so that they're not having to wait till they get through the line. So we have engaged a third party. They have put some receptacles in at some of our clinics. We're still waiting for the final go-ahead to get it started, and then we'll have some receptacles available at each clinic where a person could walk in and dispose of medications. So we are going to try to make it a little easier than the process was before. COVID numbers, I'm not going to steal the public health's numbers, so they're going to be reporting to you, so I'll let them report that. I do want to make a comment and let you guys know that the tremendous effort that our health employees were able to make in a very short time to open up access and treating those individuals that were affected by this last surge. It came fast and furious, and if you saw the graphs, you could see the spikes came very fast and furious. As you know, we had a lot of our own employees that were affected by that, so we had a constant revolving door of our employees being taken out with COVID and being quarantined, and then coming back into the workforce during that time, and the rotation that we had to navigate, as well as opening up those testing facilities. And you'll hear the numbers are staggering for how many tests we ran, and our test positive rate for that short period of time. Since then, we've, I guess I do want to make sure that everybody recognizes the tremendous job that they did, and it was humbling to see how many people stepped up when we had shortages in those departments, and people volunteered and came in on the weekends, on Saturdays after hours, to make sure all those services stayed open. So just a tremendous effort from our whole health staff, and the way they responded to that surge. Other things I want to note is I think you're going to be seeing this week a hearing aid legislation. This was something that Councilor Kidwell had brought to our attention and asked us to work on. You're going to be seeing a modification that's going to allow us to give 2 hearing aids to Cherokee citizens, regardless of their geographic location. The only thing is that it's the same policy that we have for our denture program. They have to go through our program, through our audiologist, to qualify for that program. And instead of currently, before this change in legislation, if you lived within the reservation, you got 2 hearing aids. If you lived outside the reservation, you got 1, and then you were able to purchase the other one at our cost. This will allow any Cherokee citizen to be able to receive 2. So just wanted to give you an update on that, and I think you'll be seeing that later this week in rules. Workforce updates. We have just completed, as of February 1st, a new compensation package for our nurses. We believe it'll make us more competitive. Not only did it get a raise in compensation, but we also added a longevity bonus and a sign-on bonus. So that more to come on that. That should be getting out and advertised. I think it's going to make us more competitive and hopefully fill some of those gaps that we've had for a while. We've also initiated a similar type of program that we're working on currently for EMS. As you know, through the news, Chief Hoskin has made a sizable commitment to improving, updating, and expanding the EMS program. That not only includes updating and replacing equipment, but he also enacted a retention bonus for those employees that have been with us and serving our people. We're looking at compensation and education to become more competitive and start growing our own EMS professionals. So We're working on that program as we speak. Services, we've now recently reopened our elective surgeries and our dental services. It'll take us a little while to catch up. So for those that have been on waiting lists or had their appointments moved, we are reopened now and starting to work through those lists. We have over 10,250 patients that we've signed up for Medicaid benefits through our expansion project. So that's a sizable increase in patients that have benefits that come into our system. And then lastly, I want to give you an update on construction. Stillwell is coming to completion. We're working to firm up a good grand opening date. We don't have that date nailed down yet, but we're getting closer. We have renovation and expansion projects going on in Muskogee, where we're adding a CT scanner. Nowata, where we're addition of dental and expanding our optometry clinic there. In Bonita, we're adding a CT scanner. In Oshaleta, we're adding primary care to the primary care space and the dental space, as well as remodeling the lab for some new equipment that we're going to be placing there. In Salina, we're working on a site plan and we're in the schematics portion of developing that clinic. And then here in Tahlequah, of course, we're working on the hospital and we're in phase 2 of a 3-phase schematics and space planning with our staff. The last thing that I want to update, and if I think Dr. Montgomery is on here with us, it's been very confusing on what vaccines are available to what age groups and which ones are out there. So I thought it might be beneficial, with your permission, Chair, if I had Dr. Montgomery give a brief overview of the vaccines that are available in what age groups.
Sure. Dr. Montgomery, is he there? Are you with us,
Yes.
Dr. Montgomery?
Yes.
Okay, you have the floor.
I just, again, want to emphasize that I think Dr. Jones mentioned we've given over 100,000 doses, and that's a combination of first, second, third booster doses. But in looking at those numbers, the one number that does stand out is the number of people who received the booster. It's around 20% of those received the primary series, so it's still very important to emphasize the need to get that booster dose. The Pfizer dose is approved for all of those over the age of 5 years old. The vaccine is approved for anyone over the age of 18. And again, there is a primary series, the first and second dose. And then the booster should be given for either of those vaccines should be given at 5 months after that second dose of the primary series. And again, Pfizer begins at age 5, Moderna begins at age 18. There was some information this past week about the possibility of the vaccine being approved for kids under 5, but that did not go through. That's been delayed, and that's added to some of the confusion. But currently, the Pfizer vaccine is approved for anyone over the age of 5. And again, that booster dose should be given 5 months after that second dose of the primary series. The confusing part that adds to that is people who are immunocompromised, that have their immune system's not completely intact. That booster dose is recommended now at 3 months, and that's the one big difference. So I just hope that helps clarify things a little bit. And again, if you know someone that has not had the booster dose, strongly recommend they get that vaccine. That's all I have.
Thank you, Dr. Montgomery. Questions? Sean?
Can you remind me of who's available to get our shots? Is it still beneficiaries and their spouses, or just tell me that one more time, sir?
Yes, beneficiaries and household members of beneficiaries are all eligible for the vaccine.
Daryl? Dr. Jones?
Yes, sir.
So on the compensation of pay for nurses, for those that have been there, say, 20 years and they are maxed out, is their salaries going to be raised so that they can have a new max out wage that they can earn?
The whole compensation package has changed. Yes, it's across the board now. Now I want to emphasize this is for inpatient nurses only. Inpatient nurses and LPNs. We are working on an outpatient nurses and LPN package that will follow this. Our biggest need was in inpatient, and we were pulling nurses from outpatient to work inpatient. So that was where we started. It's going to broaden out to all outpatient nurses as well. We're currently working on those market analysis now.
Thank you, sir.
Joe?
Hey, Jones, a quick question. Are you testing 2 or 3 times at Hastings for employees?
We aren't testing, we're testing with the Inspire group that HR brought in, but health itself is not testing. It's a contracted group that is doing all employees. The same group that's doing the business side is doing all the government side too.
Okay, so are they doing 2 or 3 a week?
We do twice a week, 72 hours between tests.
All right, thank you.
Any other questions for, Counselor Smith?
Yes, you know, when the 13-year-olds come out, that they could get their booster shot, how long was from that second shot to the booster, how long was the time period?
If they're a normal child, seen at 5 months from that second dose. If they're immunocompromised, then they should get it a little sooner. It was recently changed to 3 months, but the average normal child or teen should get it at 5 months from that second dose.
Okay, because there was some confusion, because I had people saying, well, they're supposed to give them in 3, not 5, so that answer. Thank you.
Any other questions for Dr. Jones or Dr. Montgomery? Okay, see no hands. Thank you, Dr. Jones. Thank you, Dr. Montgomery.
Thank you.
Okay, we're moving down to a report from our Cherokee Nation Public Health Team, Lisa Pivek and Dr. David Gann. Are you both there?
Yes,
Okay, go ahead, Lisa.
thank you. Good afternoon. It's good to see all of you. I had my report in front of you. I just want to highlight a couple of things. Of course, first off, I want to commend health services, the clinics and the hospital, and all the work they've done during the month of January. It's been phenomenal to watch all of that take place, and very thankful for that. Public health, we actually did 29,141 inbound and outbound calls during the month of January. So our entire focus was on the response to the Omicron variant and trying to get people isolated, helping people figure out what their note situation needed to be for their work or their school, trying to provide general direction, answering questions about anything that you can imagine that may have come into the hotline or we may have called out to give them information from. In doing that, I want to take time to thank both Career Services and Education for helping us by supplying some employees to help us through this crunch. It was very welcomed, and we appreciate all of that. WIC and the Male Seminary Rec Center did not participate in the actual COVID response as far as contact tracing, case investigation, hotline calls. They remained open and their service is consistent. You'll see all of that information in your report. We have lots of upcoming projects, as you'll see hints of on the report, that we hope next month in the month of March, if we keep our fingers crossed and it looks like good news is on the way in the COVID-19 front, that we'll be able to get into these projects more in depth through the next several months and gain some momentum on them. We have several documents coming out for you to review. And we also have several projects related to cross collaboratives with education, commerce, environmental health and environmental services, as well as the new wing schedule, more virtual classes, and continued work with our schools and communities. I will turn it over to Dr. Gann to give you that update for the month of January in relationship to Omicron and the surge.
Thanks, Lisa. Thanks, Mr. Chair. Yeah, January was a really tough COVID month. On January the 18th, we had 1,333 new cases in one day. So you can imagine the challenge that put to our whole health system and public health as well. We peaked on that day for the 7-day moving average of 766 cases per day. And from that point, it's dropped very rapidly. Today, we're at 69 cases per day, compared to 766 Last week, our positive test rate was 20%. The peak was at 45% back in January. We're averaging 469 people tested per day. That's dropping quickly as well. So unfortunately, the numbers are a great relief to what we went through in January, but we still have widespread community transmission. All of Cherokee Nation is still in the red, which is more than 25 cases per day per 100,000 people. The state reports those numbers every Wednesday, so we'll get a new batch of numbers in a couple of days. We're anywhere between 70 and 120 cases per day per 100,000 at the county level for each of our 14 counties. There's still a lot of virus out there. We're still testing, but the numbers are dropping very fast. I think in a few more weeks, Cherokee Nation and all of our counties will be in the orange level, which is less than 25 cases per day per 100,000 people, and it'll continue to drop from there. There aren't any new variants on the horizon. There's a global surveillance system keeping track of cases and variants. There's still several countries around the world that are increasing with their numbers. Russia, South Korea, Japan, New Zealand, I think was going up as well, and then a few countries in Africa. So it's still out there. Globally, the daily number of new cases is 2.5 million, down from about 4 million earlier, but still a tremendous number. And we're at just under 2,000 deaths per day in the United States. We lost 12 patients in the month of January to COVID-19, and we suspect there's more. We just haven't been able to track every case down yet. Our vaccination rate in Oklahoma is at 56%, really hasn't changed much through the surge, and about 35% of those have received their booster shots. Not all of those that have received the primary series are eligible for the booster yet. But our vaccination rates are still low. If lots of data continue to come out, very robust data, that the full vaccination series with the booster is highly, highly protective from severe illness, hospitalization, and death. Well over 95% for all of those. So the number one best protection we have against another surge is vaccinations. Of course, all the other mitigations still apply, but there's most of the epidemiologists are predicting a good spring with no new variants on the horizon. But of course, I'm anxious. Over the last 2 years, we could get a report next week saying they discovered a new variant. So we're watching, and that's our job. And we'll let you know if anything new shows up. But we are definitely feeling the relief here in Cherokee Nation Health Services, Cherokee Nation Public Health. We're on the mend. That's all I had.
Questions for our public health? Dr. Gann or Lisa? Any questions? Dr. Gann, you said we had some robust data. Do we have any data at all that measures our natural immunity in our community? Any data at all?
No, I'm not aware of any data locally or in the U.S. There's a study out of Madagascar, no, Qatar, showing the protection that natural immunity had from getting Omicron. And it was about 60% reduction in becoming infected. So that's about all the data we have, but I'm not aware of the current level of antibody levels in our area.
Okay. Lisa had a question. I was just looking through the report on page 15 about our Healthy Native Diabetes Prevention Program.
Yes, sir.
They just list how many participants we have. Is that a low participation rate, or is that about what we expect on that?
On the virtual classes?
Yes.
Yes, pretty much. Now, I will tell you that is the public health portion of that, which is the community portion. There is also a diabetes prevention, Healthy Native Diabetes Prevention Program that falls under the diabetes program realm within the clinical delivery services that offer classes as well, and those should be in the report somewhere as well. We do not in public health collect those specific numbers. We just collect the community-based classes that we hold that are through virtual right now, which we're hoping to move to in-person as soon as we can.
Okay. And I know we had to put this kind of on the back burner. The public health was doing profiles on all the individual districts. Do you anticipate maybe at some point being able to provide our individual counselors reports on their districts?
Actually, Dr. Gannon and I had that discussion on Friday of if it's calm enough now that we can go full blast in and finish that off so that we can get those to you. And hoping so, the way the cases are dropping, we hope to get all of those epidemiologists back on that work.
Could you kind of summarize to the counselors kind of what this report might have, what they might be looking for?
Sure. It's basically a host of information about the county in general, related to county health behaviors. Some of that information is collected via CDC and state information. Some of it is collected from the tools that we use within public health. In particular, the physical activity assessment that was done back in October of 2019. It's the summation of some of that information coupled with particular leading causes of disease, but then also those behaviors that contribute to that disease. There's also some information about resources in those communities, what is available right now, and people's opinions on their use of that resource currently available. I have asked that since it's been such a long time since COVID, that we revisit that geographic information again to make sure that it's still up to date as far as resources, so that we are giving you the correct information as what's available for your constituents in their various areas.
Okay, any other questions for, Counselor Austin?
Lisa, on your wings races, are they live? Are they scheduled to be live, or are they still scheduled virtual? How's that working at this point?
Right now, they're still virtual. We obviously are waiting for direction. Dr. Gann and his team at EPI will let us know when it's safe to start proposing that we go back to live events. We're hoping that is this year, late spring, summer, but we have not made that decision yet. Even when we do go back to live events, though, we will continue virtual. We had such a great reception from folks who are not able to make races on Saturday or prefer to do it on their own. So we'll continue both virtual, and when it's safe, we'll be back to in-person.
All right.
Any other questions? Thank you, Counselor Crittenden.
Sorry, Doctor.
All right.
Lisa, some good folks, Public Health in Stillwell, we were visiting about a year ago, just kind of brainstorming some ideas, and we'd come up with we were talking about a mobile, not a mobile trail, but a mobile project where they were doing some walking trails, like at our place down there, Carson Park. Just so far a distance. You know, we put up some information about some of the stops on our trail of tears. You know, just information. And I think there was some confusion with communication, not wanting to be involved with that because they thought it may have been. They thought we were talking about a kind of a mock, smaller Trail of Tears, you know, exercise. They didn't want the exercise and the Trail of Tears to kind of get mixed up there. But if you'll look into that, what we had in mind was just, it's of course healthy, you know, for our youth to walk and even the adults, of course. But boy, we thought it was neat, you know, just along our walking trail there, just some information, you know, that folks around here really don't get, or you know, so I think it would be a really neat thing, and if you could look into that for me.
Sure, I'll get with the staff and see. Were you working with public health staff in particular? Which were you working with, our staff or other staff?
Yeah, yours.
I'll dig into it now.
And there was just confusion there, I think, with communication and public health for what it was meant to be and what it wasn't meant to be, but I think it'd be a really informative thing and throw in a little healthy thing for our people. So thanks for looking into that.
Yeah, we can certainly visit that. I don't know, it's been several years ago, over 10 maybe, that we did develop a curriculum specifically for fourth grade that factored in the Trail of Tears and healthy behaviors, and also had community responsibility and kind of had all of the aspects within it. So it might be
Okay.
something for this project too.
Well, thank you for looking, man. Bye.
Okay, Lisa, Dr. Gann, thank you for being with us today.
Thank you.
Okay. All right, moving down to old business, I see none, or new business, none pending on announcements. Next month in health, the intent is to bring our behavioral health department in and giving a report during health. And, of course, our behavioral health area has been extremely busy during this time. They're always busy, but this in particular, it has stressed them as well. So, but that will be forthcoming on next health, which will be next Monday, March 14th. It'll be at 12:30 and not 1. It'll be 12:30 on Monday, March 14th. Joe.
I'm just gonna make a quick announcement during health that we lost Lanake Harjochi. She actually went in a while back and did a knee replacement, and that basically just fumbled. She was a young lady, but she was a fighter of our sovereignty on the grassroots ground. So I just wanted to mention her during health to make people aware, you know, it's not just olders that we're losing and youngers, but it's actually healthy people during this time. So I was just doing it during health to make people aware that she has passed on. So thank you.
Thank you, Counselor. Any other comments? Candace?
I just wanted to make a quick comment, a quick thank you to Cherokee Nation Health Services. I've had a couple of friends and a family member recently have unexpected stays at Cherokee Nation Health Systems, and they all said that they were treated very, very well by the staff, that they didn't have any need that went unanswered, and that they had a great experience during their time with Cherokee Nation Health. So I wanted to make that statement during Health Committee and just commend all of the great work being done at Cherokee Nation Health Systems.
I know I get fairly regular emails that kind of state that very thing too, Candace. Oftentimes we just hear about the situations that individuals want corrected, but we have a lot of praise out there for our healthcare providers. Any other? I'd entertain a motion to adjourn. Second? Okay. We're adjourned.